And we don't have to do a countdown for PCT.
Okay, just make sure. You ready?
Yes, I'm ready.
Good afternoon. I haven't actually used this in a while, so just making sure it works. Good afternoon.
Get over this way.
Welcome. We will call to order this May the 4th meeting of the Tacoma-Pierce County Board of Health. It's June 4th. Yeah. I'm looking at the minutes. That's why. Thank you. June 1st meeting of the Tacoma-Pierce County Board of Health. It's 3:30. Will the clerk please call the roll?
Chair Young?
Here.
Vice Chair Ushka?
Here.
Board Member Baggett?
Here.
Board Member Campbell?
Here.
Board Member Danmeyer?
Excused?
Board Member Daniels?
Excused?
Board Member Morrell?
Excused?
Board Member Ryasich?
Excused?
Alternate Board Member Hayden? Excuse me, I'm sorry. Alternate Board Member Hitchin? Here. Roll call is complete.
Thank you, and we have 5 members and a quorum. And before we get to comments by the public, I just wanted to say welcome to all of you, and it's good to see you here in person. It's been a while, so since I haven't done one of these in person, I've chaired our own council. Forgive any missteps because we do things slightly differently. That does bring us to...
Sure.
Yes.
I actually have a point of order. Could we get a quick primer on how these microphones work? Do we have to press the button to speak, or do you get called on?
To turn your mic on.
So it's live when the light is on.
Correct. Yes, thank you for asking.
Wanted to be sure that they weren't on all the time, despite what the light said.
Yeah. Thank you. And yeah, do just wave at me if you want to get my attention, since we don't have the buttons. That brings us to section 3, comments by the public. Do we have any written?
We did not receive any written public comment.
Thank you. At this time, if you'd like to speak to the board on any subject that isn't on the agenda, we will get to the agenda items later. Please come forward, state your name for the record, and limit your comments to, I can't remember, do we do 3 minutes?
2 minutes.
2 minutes for public comment. Is anyone wishing to speak? Anyone wishing to speak? Seeing none, we will close public comment and bring it back to the board. Brings us to section 4, consent agenda. Is there any item, just the minutes, that a board member would like to remove from the consent agenda? Seeing none, is there a motion?
Chair, I move approval.
Second.
Been properly moved and seconded. Any further discussion? All those in favor, say aye.
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 Those opposed, say nay.
Aye.
The ayes have it, and it sounds like we do have a board member on the phone.
Board Member Morrell is on the phone.
Oh, thank you. Welcome, Board Member Morrell. That brings us to section 5, the regular agenda. Item number 1. Could I have a motion?
Chair, I move approval of resolution number 2022-4743.
Second.
Thank you. It's been properly moved and seconded. Will the clerk please read it to the record?
Resolution number 2022-4743, authorization to update Environmental Health Code Chapter 9 to align with Washington State Chapter 70.345 and results from the June 2nd, 2020 appellate court decision.
Thank you. And I believe Mr. Adams, the Healthy Resilient Children and Youth Manager, will be introducing this.
Yes, Board Chair Young, Board Vice Chair Ushka, and members of the board, thank you for inviting me to bring Resolution 2022-4743 before you. My name is Len Adams, Healthy Resilient Children and Youth Program Manager in the Strengthening Families Division. On May 4th, the board heard an overview of the proposed revisions to the Environmental Health Code, Chapter 9, restrictions on the use of vapor products. Our updates are based on the appellate court's decision and align with Washington Administrative Code, Chapter 70.345 RCW. In this revised code, we modified where you can and can't vape. Vaping will remain prohibited in all public spaces except for vapor retailers. We removed tasting and related enforcement. We expanded the definition of vapor product to include unapproved nicotine delivery products. and we updated data and clarified language. Pierce County continues to be a leader in tobacco and vaping laws in Washington State. Our code continues to be stronger than state vapor code, and we ask you to approve this resolution to revise this code. Staff will continue to share updates on vapor and vapor products in the future with the board.
Great, thank you. Are there any questions from the board? Not seeing any. Thank you, Mr. Adams. If you'd like to speak, we'll go to the public hearing. If you'd like to speak on resolution number 2022-4743, please come forward, state your name for the record, and limit your comments to 2 minutes. Anyone wishing to speak? Seeing none, we will close the public hearing and bring it back to the board. Final comments from members of the board. Board Member Campbell.
Chair, just curious, do we need to check with the online to see if we have any comments online?
And there are no comments, no raised hands online.
Okay, thank you.
Thanks for reminding me, though, because that is an option for the public. Not seeing any comments from the board. Motion is to approve R 2022-4743. All those in favor, say aye.
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 Those opposed, say nay. The ayes have it. That brings us to item number 2. Is there a motion?
Chair, I move approval of resolution number 2022-4744.
Second.
It's been properly moved and seconded. Will the clerk please read it to the record?
Resolution number 2022-4744, authorization to contract with Strong & Nielsen Strategic Marketing Incorporated in the amount of $475,000 to purchase advertising on behalf of the agency on a wide array of media outlets and distribution channels for the period of June 1st, 2022 through December 31st, 2022.
Thank you. And introducing this, we have Edie Jeffers, our communications manager.
Good afternoon, Chair Young and members of the board. I am excited to bring to you this resolution for a contract that is up to $475,000. This represents really a quality improvement approach that our agency is taking to media contracts. Instead of having multiple contracts throughout the year to purchase advertising campaigns, we are contracting, if this resolution passes, with a media consultant to basically buy the market for us related to specific goals and objectives for programmatic advertising. This does save a considerable amount of time for our procurement office. Instead of doing multiple dozens of contracts, sometimes with very short time frames and for small budgets even, we will have one comprehensive contract and kind of a pool approach to buying media of all descriptions. I'm happy to answer any questions about this contract with a woman-owned business right here in Tacoma. We're very excited to work with them.
Thank you. Questions from the board? Vice Chair Hitchcock.
Thank you. I don't have a question, just comments. I'm delighted that it's local and women-owned, and I have an idea what it takes to do all that contracting, so it's a huge lift off the shoulders of the folks at the health department. At some point, I'd love to learn a little bit more about how that works, because how do you know what they're doing, if that makes sense? But that's for personal reasons.
Sure.
So, but it's a great idea, and I'm really glad to see it happening.
Great. Thank you. We are as well.
Yeah, I bet.
Any other questions? Not seeing any or hearing anything from the phone. This is a public hearing. If you'd like to speak on resolution number 2022-4744, please come forward, state your name for the record, and limit your comments to 2 minutes. Anyone wishing to speak? Anyone indicating online?
No one indicating online that they would like to speak.
Okay. Seeing none, we will close the public hearing and bring it back to the board. Final comments from members of the board. This sounds like an exceptional idea. Great job. All those in favor, the motion is to approve resolution number 2022-4744. All those in favor, say aye. Aye. Those opposed say nay. The ayes have it. And that brings us to Section 6, which is comments by the Director of Health. Today that will be our Deputy Director, Cindy Jitsi.
Good afternoon, Chair Young, Vice Chair Ashka, and members of the board. I'm Cindin Jitsi, Deputy Director for the Tacoma-Pierce County Health Department, and I am filling in for Dr. Chen, who is on vacation this week. So I have 4 updates before we go to our presentations. The first is we wanted to let you know that we've added Juneteenth, which is celebrated on June 19th, to our list of health department holidays. So starting this year, employees will receive June 19th as a paid holiday. This year it falls on a Sunday. We will observe it on Monday, June 20th. Juneteenth is a holiday to reunify people across races. It celebrates our transformation from a slave economy to an industrial economy and the end of centuries-long racial bondage. We welcome all staff and board members to join in the celebration of this day. An update on our bathroom remodel. Those of you who have been board members know that we've been talking about this for a while, and we are finally making it happen. So our operations team will be busy with our D Street public restroom improvements in the coming months. We paused plans for this when our COVID response began, and now we're ready to press play. So we've already created floor plans with an architect. We've shared plans with community members and customers. We surveyed staff and answered questions, had dialogue, and we got input from our diversity and inclusion team. Next, we will implement a formal bid process, and then we'll come to the board requesting approval for that contract. Then we can finally start construction. So we'll continue to keep you updated on progress with that bathroom remodel.
For anybody listening, just to be clear, D Street side of the public restroom means it's on that side of the building and is open to the public, not that it's a public restroom on D Street.
Thank you for clarifying that. Yes, exactly.
Wanted to make sure that was obvious.
Yes, thank you. This is the bathroom where at the main entrance people walk in and it's immediately on the right-hand side, and it is woefully overdue to be updated and come into compliance with ADA requirements. So we absolutely need to do this. We have an opportunity for board members to learn about some community work that we're doing that promotes healthy youth living cannabis-free. So on June 15th at 3 p.m., the Pierce County Prevention Collaborative members will share their stories and examples of work during a virtual meeting. We sent an invite to Board of Health members who might be interested in the most recent Public Health in Focused email update. If you didn't receive that and you're interested, please let me or the board clerk know, and we can send you another direct link to that event. Our partners in this work include Tacoma Urban League, Mission Africa, Boys and Girls Club, Greater Christ Temple Church, Tahoma Indian Center, and Peaceworks United. We'll also see work at this meeting for youth and by youth to promote the benefits of living cannabis-free. So yes, if you're interested in learning more, it's really great work that collaborative does. And then finally, a COVID update for you. Again, we are presenting to the board a monthly, we've moved to monthly updates, so you'll get a more thorough update from Nigel Turner at our study session this month. But just so you know, we updated our COVID-19 data dashboard to better serve you. We still have all the data that you've come to expect, and we're highlighting some new metrics so you can more easily assess your own risk. You can read about these changes in our recent blog. The webpage now loads more quickly and is easier to navigate on mobile devices. We heard that that was something board members and community members wanted. We've aligned our key indicators with data points that the Centers for Disease Control and Prevention are now using to decide COVID-19 community levels. So they have a low, medium, high rating that they use for every county in the nation. And so we've aligned our key indicators with what they're looking at as well. To better reflect our goal of getting everyone who is eligible up to date on COVID vaccinations, we're now highlighting that number on our main data page as well. Right now, 37% of Pierce County's population is up to date, and of course we'd like to see that increase and continue to work on that. And just so you know, you're considered up to date once you've had your primary series of doses until you're then eligible for a booster. And at that point, when you're eligible for a booster, you need that booster to be considered up to date. So that's how that's defined. Right now, our levels of COVID transmission are at medium. I referenced the CDC, and so we'll continue to keep the board updated if we anticipate any changes to that. So before we move to presentations, I'm happy to answer any questions that you might have on those topics or others.
Vice Chair is good.
Thank you, Chair Young. I've got one question, and it's about boosters. I mean, as we've been going along, it's been kind of, we're learning as we go. Is that the intent of the way forward, or is there any better information on how long boosters last at this point?
I am calling up Nigel Turner, Division Director for Communicable Disease Control, to more fully answer that question.
Thank you.
Thank you for the question, Chair. It's good. Nigel Turner, Division Director for Communicable Disease Control. Yes, we're learning much about COVID as we've gone along. We know now that immunity does wane over time, although still there's some protection against more severe disease, hospitalization, and death that is retained. Boosters continue to be very, very important, and regular boosters, I think, will become a regular feature of COVID moving forward as we move into kind of the stage of living with COVID in the long term. It's clear it's not going away anytime soon. But we have yet to find out what's the final schedule. Will it be an annual booster, or how that will look like? That's still yet to be determined.
That's exactly what I was wondering. Thank you so much.
Nigel Kimmel. So what's the schedule if you have J&J? That was supposed to be a one and done, and no.
Unfortunately not. No, there's another booster that's required to complete that.
Does that come from J&J
No,
then, or
that would be any of the other vaccines would be appropriate for a booster dose. And we've actually very little J&J vaccine left in the county, so we'd encourage you to get one of the mRNA vaccines. There is actually another equivalent vaccine that's will soon be on the market, equivalent to J&J, but J&J is now preferentially not recommended compared to the other vaccines that are available, which are plentiful in the county.
Thank you.
Any other questions from board members? Not seeing any.
Thank you. That concludes my remarks, and I'd like to call up Sun Mon, our Refugee Health Program Lead, to talk with you about our Refugee Health Program.
Thank you.
Thank you, Cindy.
Welcome.
Well, let me do one more for you soon.
Sorry about that.
That's okay. All right.
Too many slide decks.
There you go. All right, now you go back.
But I have to.
There you go.
Good afternoon, Chair Young, members of the board. My name is Sun Man, and thank you for giving me the opportunity to present about our Refugee Health Program today. Before I start, I'd like to introduce Mr. Daryl Morrissey. He's the Director of Refugee Resettlement from Lutheran Community Services Northwest.
And I
Is
apologize,
here-
if you don't mind, just, unfortunately, these mics don't pick up very well, so if you could just speak really directly into it.
Okay.
We always
thank
have
you.
this trouble
Sorry
hearing.
about that.
Oh, no, it's fine. I'd forgotten how bad these mics are.
Right. Thank you. And so there's Mr. Darrell Morrissey from Lutheran Community Services Northwest. And he will talk to us later on about our partnership and collaboration in refugee health. We will discuss about our department role in refugee health, how we partner to make this program work, and then to provide you some arrival data, also to make sure that to explain to you why refugee health is about health equity and how it's connected to our department strategic planning, and also how you can help. Thank you. Before coming to America, refugees will receive a health screening from overseas. After arriving in the U.S., they will receive a domestic refugee health screening. And with that, we public health come in to prevent, to make sure, to prevent and control infectious disease in the refugee arrival, such as tuberculosis, measles, polio, COVID-19. We also follow up on medical issues identified in an overseas health screening. We make sure that our refugee arrival receive health care, access to health care after they arrive in our county. Also, we want to introduce them to our U.S. healthcare system, because coming from another country, this would be very strange and not familiar to them. And also to establish a medical home. It's very important to have a primary care provider to go to when you are sick, or for your physical exam. That's how we educate our arrival after they come to our county. Also, at the end, to promote health equity in these populations. From federal to state partner level, we receive funding, we receive notification, and also guidance to screen our refugee arrival. Locally, we contract and partner with Community Healthcare Eastside Canberra Medical Center, who have a refugee health clinic to see our new arrival. And also, we contract with an infectious disease consultant in Pierce County to review and evaluate any suspect for TB disease in the new arrival. Also, we work and partner with Tacoma Community House with the multicultural self-sufficiency movement. These two non-profit organizations provide assistance to our new arrival with English as second language classes, employment assistance, or immigration services, because the refugee will need help with that. During the last 5 years, we received a total of 1,036 refugee arrivals. Of these 5 top countries, our refugee arrival from Ukraine, Moldova, Afghanistan, Russia, Iraq, Iran, and the rest of the countries are from Congo, Nigeria, Turkmenistan, Belarus is some of other country for the rest of the number. I'd like to talk a little bit about this though. I'm sorry. So why Ukraine? Why we have a lot of refugees from Ukraine? It's mostly because of refugee status, because where they came from, and then of course because mostly is the U.S. tie. When we call U.S. Thai, that means they have families, relatives who live here, and that's how they come into our county. We provide information and resources for our refugee and providers on our website. Particularly, there is a brochure in targeted languages, and that help to guide our refugee arrival of what we do to help them after they come into our county. We send a brochure in language and a letter to welcome each of the family when we know that they are in our county. And now I'd like to introduce Mr. Morrissey to speak about our collaboration and partnership.
Thank you, Sun. Chair Young and Board of Health, my name is Daryl Morrissey. I've been involved in refugee resettlement around the world for about 20 years. And since February, I have been the Director of Refugee Resettlement for Lutheran Community Services Northwest. I want to thank you for this opportunity to share about the collaboration between my organization and the Tacoma-Pierce County Board of Health. So, That's okay. That's okay. So they gave me 2 minutes to talk about my life's work. So I will do that quickly now. What we do is each year the United States sets a number of refugees that we're going to resettle into our country from around the world. And there are 9 national agencies, of which LIRS, the Lutheran Agency, is one of the 9, and that's our national agency. I've been there in Baltimore for the past 7 years. Just recently came here. Our job is to receive refugee arrivals. That means we pick them up at the airport, but even before that, we have to make sure they have a place to go. So we find an apartment, we set up the apartment, we make sure that everything is ready for them to come. We take them to the apartment from the airport. We, over the next 90 days, we have a contract with the federal government. There's certain specific services we have to provide, including health services. So we make sure that they are connected with the Board of Health here. And that would take us down to that first white line there, receive notification from us that these refugees have arrived. Then the Board of Health will notify the clinic provider that people are there. They will set up the appointment, and then they will notify my agency that the refugees now have an appointment with the doctors. We provide transportation to that initial medical check, and then if there's any follow-up, then that comes back to us as well. That take 2 minutes? All right. So after that 90 days, then we'll make sure that they are connected with a PCP, a personal health care provider, and anything else. Do you have any questions about the relationship between our organizations?
I'm not seeing any. Thank you
very much.
Thank you, Mr.
And now that will bring us to the stream. Our program is a collective effort, and it makes sure that we work through the strategic planning from that vision, mission, values, continuing priorities, and also strategic initiatives. We make sure that our refugees are healthy physically and mentally. We make sure that our families and children are healthy and resilient. And of course, where our refugees arrive from, we live in multicultural communities. Therefore, raising awareness of health equity and racial justice is very important to us. And we make sure that when they are here, they are educated, they learn more about our U.S. healthcare system, and that receiving equal access to healthcare is very important. And again, because refugee health is a collective effort, I'd like to end our presentation with the slide and with a story that very personal to me. a few weeks ago, while I was walking in my neighborhood, Central Tacoma, I came across with a friend. I was walking with a friend, and I came across with a family of 6 parents, 2 young boys, 2 young girls, and I recognized them right away because they must have been one of the many families that we received recently from Afghanistan. The young girls and mom were their jihad. Now tell me what? They are new to the community, but they feel safe to walk the neighborhood on a Sunday evening. And it was nice. I was out walking with my friend. So we came across, we say hi, and I said to them, welcome to America. Welcome to Pierce County. And they were so happy. And I was able to tell my friend about the messages that they are new and they are from Afghanistan, and how we receive them and how we help and support the community, them with the community. So I did my part, and I would like to see if all of you and board members, if you can help and promote positive messages about the new arrival, continue your support of the new arrival, because where they come from and why they are here now is very difficult. And it brings me back to where I was over 30 years ago. I was a refugee from Vietnam. I was one of the bold people. I came to this country. I went through the same thing. Refugee house screening, domestic refugee house screening, navigate the new land, learning, and contribute to this society. Thank you for your attention.
Thank you.
Thank you.
Any further questions or comments from the board? Vice Chair Ishka.
Thank you for your presentation. I really appreciate the simplicity of simply talking to people and saying welcome, right?
you.
And I don't know that that's something, in our culture, you walk by people all the time and don't say hello. I do it on the trails all the time, and it makes people happy. In terms of the board being able to project this message, we can do it in our circles, of course, but I would suggest that maybe there's I don't know if there's some specific time that's where refugees are highlighted, but it would be kind of neat to do a social media campaign that really tells people that eye contact and recognition and seeing somebody literally and saying welcome can make all the difference in the world. And that's all I wanted to say.
Thank you very much for your comment. And that's what I do every day with my work. I work with refugees, I work with immigrants, and when they come in to see us, welcome to America, symbol. And that makes their day, my day. And thank you.
Thank you. Not seeing any other comments, and just wanted to say that we are probably going to be seeing a significant number of additional refugees coming our way, especially because of the cultural affinity that we have in the Tacoma-Pierce County area for Slavic countries, and obviously given the war there's been a ton of displacement. Many will return at some point, hopefully when the war ends, but many will choose to stay here, and I, when I think back to the fact that when around the time I was born, so many people came from Southeast Asia, and it's impossible to imagine Tacoma, Pierce County without that community now. So I know the county council has appropriated some funds to work with our partners at Lutheran Community Services, and in both times in response to conflicts, but we can continue to do the things that you've suggested to show our ongoing support. And maybe there's something we could do as a board as well. I know we've done proclamations for refugee. There's I can't remember the exact language, but it's something along of refugee settlement, day or week or something. So maybe we could look into that.
Thank you.
I'm seeing a nod from.
Well, Refugee Day is generally June 20th.
Thank you.
World Refugee Day. Thank you.
Okay, and that brings us to our next presentation. Do you have an introduction, This is on breast cancer surveillance in Pierce County with Ingrid Freeberg, an epidemiologist.
Hello. Let's see here.
One of them.
One of them. You have a few of us around here. Let me get this started. Here we go. Is this the right place where I can be heard?
It's
The best that you're going to get?
I think that's about as good as it's going to get, yeah.
Well, I can certainly try to be loud. That's never a problem for
Thank
me.
you.
Well, thank you very much, Board Chair Young, board members. I really appreciate you giving me, Ingrid Fiber, one of the epidemiologists, an opportunity to present on a project that I've just completed looking at breast cancer in Pierce County. I'm going to present a little bit of information on what is breast cancer, a little bit about the data that we're going to be using to talk about it, how we do our surveillance, how we follow up what's going on, and then some of the key messages from our work. Well, that doesn't look very good. Sorry, the slide doesn't look as good. It printed out much nicer.
Oh, okay.
Breast cancer is the most common cause of cancer in women. It is also the second most common cause of cancer mortality in women. This is a huge burden on our health system and on our women, knowing that 1 in 8 women will be diagnosed with breast cancer throughout their lifetimes. Here I am attempting to show a simplified image of what is breast cancer. We know that there are risk factors which affect whether or not a woman will be diagnosed and develop breast cancer. There are also risk factors who determines who decides to get screened, as well as who accesses treatment, as well as who survives that treatment. I am using the word risk factors in a very broad way. I'm talking about the human biology. I'm talking about the exposures that a woman actually has over her lifetime. I'm talking about the access to the health care and any other correlates which determine whether or not a woman will access that screening and access and survive treatment. Surveillance of breast cancer cannot be done with just one of these pieces of information. They are inextricably linked, but we need all of them to truly understand the picture of what's going on with breast cancer. The box on the top right is supposed to show treatment and say, I'm not going to be talking about treatment because it's far more complex and far more related to the individual associations between a woman and her healthcare provider. First, I'm going to tell you a little bit about mortality. Mortality is just the tip of the iceberg because we know that many women will survive for 10 years or longer. We use vital records survival information on this for this particular graph. In here, we show what's going on with breast cancer on the right for all women in both Washington State and Pierce County. The 3 sections on the left look at breast cancer in women 40 to 64 years of age in both Pierce County and Washington State. It's a little bit complex, but if you look on the right-hand side, you see that there are no real trends of what's going on in women dying in Pierce County or Washington State. But if you look on the left-hand side, you can see that for women 40 to 64 years of age in Washington State, there has been a significant notable decline. So that's good. We're seeing improvements. What we can't tell is whether or not that improvement is translating in Pierce County as well. We just have a smaller set of numbers. So it's important to both look at our own data, but also to compare what's going on in neighboring communities to help understand what's going on. We can also look at information on breast cancer mortality by focusing on the individual populations. In this case, I'm showing the racial and ethnic distributions of people who have been dying of breast cancer. This particular graph is a really important example of surveillance. It shows us a lot of important things. First is that it is very important to disaggregate our populations. We can't just combine everybody together, because the patterns within these different populations are different. If you look on the far right, you'll see that the white population has one trend. Their mortality is declining. You can see over here. Significantly, wonderfully. That is very different from the Asian population, which is flat, the American Indian, Alaska Native population, which is increasing, and also different from the Black and African American population, which may be declining. So it's really important to see these differences because not every population is the same, even in Pierce County or in Washington State. The other important point is that disaggregation is important. At the national level and in previous iterations of this, the Asian and the Native Hawaiian and other Pacific Islander populations were combined. That hides something really important. Whoops. If you look here, there's been no change in the Asian population. If you look at the Native Hawaiian population, you see there's a tendency, potential of an increase. But more importantly, the absolute levels of the mortality risk are much higher. By combining those groups, we're hiding what's really going on in these populations. We need that information. Of course, for a woman to die of breast cancer, they need to be diagnosed with breast cancer. If we don't know about it, we can't measure it. This shows that in Pierce County and Washington State, there may be a decline in incidence in diagnosis of breast cancer, but it's really hard to see, and it's not very strong even if it's there. It's just a little bit. When we look at who is being diagnosed with breast cancer, what we see here is that the peak, the largest number of women are diagnosed in the ages of 65 to 69. But half of all women are diagnosed and potentially dying prematurely in the age group of 40 to 64. That is where breast cancer screening can have the greatest benefits.
Is the previous slide, is that age adjusted or?
This is age adjusted, but it is looking at all women throughout all of Pierce County and Washington.
The reason I ask is noting that curve.
Yes.
There, and the fact that our population is aging, I'm wondering if it would be more pronounced of a decline in incidence if you were adjusting for the fact that we're also getting older at the same time.
Okay. Well, this includes the age specific. So what we're doing is this is looking at, given the people who are being diagnosed or living here, this is for their ages compared to a national standardized age.
Got it.
What is going on. So the reality is the absolute number of people in Pierce County may be increasing because it's in older population, but it's actually not likely to be. I'll show you a little bit later. There's actually younger populations.
That's what I was getting at. Thank you.
And this is really where, like I said, 50% of people who are being diagnosed are in this 40 to 64 age group. And when you look here, which is the incidence, the diagnosis, you see that there might be a trend declining of incidence in women who are in the age of 40 to 64. But it's small, it's not huge, it is probably not nearly as much as we've seen for the mortality in the previous section of this. And this is once again showing why you need to have local data, because we can't really see what's going on in Pierce County. It's not as notable as what's going on in Washington State. We've also done this analysis for smaller populations just to learn a little bit more. Another factor is that when a woman gets diagnosed with breast cancer, they stage her breast cancer to tell you a little bit about what her prognosis is going to be. Is she going to live for a longer time or shorter time? They categorize it in 4 ways, where the first 2 at the very top, in situ and localized, are considered early stage, which has the best prognosis, the longest survival, and regional and distant, which has the worst prognosis, the shortest survival. Another category, and this is really what I want to highlight in here, is this one called unstaged. Unstaged means we don't know. They may have left the health system, they moved out of the county, may have moved into the county. There are lots of different reasons, but we just don't have enough information to know what that stage is. When we look at the data at the national level, we can see very clearly that this is a complex mix of all of the different stages. So it's a lot of different kinds of people who are not getting adequate information. Why is this important? Because we don't know what's going to happen with them, and it might indicate inadequate associations with the health system. This graph is trying to show what's going on in terms of whether or not people are being diagnosed early or late, in a timely fashion or not a timely fashion. The left bar shows that in Pierce County, what we have is a distribution with about 4% who are not being diagnosed at a timely fashion for the sense of unstaged. When we look at some of the different racial and ethnic groups within Pierce County, we find that that's very different. With the Native Hawaiian and other Pacific Islanders and unknown and the American Indian Alaska Native populations having a much higher proportion who we just don't know what the stage is at diagnosis. This is concerning because we need to have that information for adequate health care. Another factor is looking at the proportion that have early stage diagnoses. Obviously, 68.9% is about the right number for the entire population, but it masks a lot of differences where you can see very clearly that only 47% of Native Hawaiian and other Pacific Islanders are being diagnosed at an early stage. Only 62% of Black or African American women are being diagnosed early. This has implications for their survival and their prognosis. But how do we know when people are being diagnosed? Well, it has to do with when they're getting their screening mammograms, for the most part. What we are trying to do is get people in as early as possible to be screened so that we can have the earlier diagnosis. If we look at women just in that 40 to 64 age group, we see that in Pierce County, this is two different portions of Pierce County, we see that approximately 70% are being screened within the past 2 years. In another portion, which is closer to the Carol Milgard Breast Center, it may be declining, but we don't think this is real because this is based on small numbers. This particular survey also, you can see, includes data from 2020. We do not think that this is notably impacted by COVID because most of the mammograms that we're talking about, people asking about, were in 2018 or 2019. This will change in 2 years or 3 years when we do the analysis next. Once again, there are significant differences in who gets screened. Interestingly enough, some of the populations with the highest mortality, such as the Native Hawaiian population and the Black population, have some of the highest screening rates. So even with high levels of screening, you can have significant levels of mortality and disease. So we need to make sure that we're getting them early, not late in the process. We tried to look into more details about who are these women who are not being screened. What we have found is quite interesting, and unfortunately is no different than what we found 5 years ago when we did this previously. Women who did not graduate from high school. Of those women, 60% had not had a recent mammogram. Among women with a low annual income, 53% did not have a recent mammogram. Among women without health insurance, 59% did not have a recent mammogram. And if you have a population of women without a personal health care provider, 72 had not had a recent mammogram. These are not the largest populations in Pierce County, but these are the populations where a lot of women are not being screened appropriately and timely. So why is this important? Because in order for us to do adequate surveillance on breast cancer, we absolutely need the local data to know what's going on. Without that, we can't make decisions. We can't disaggregate the Native Hawaiian population from the Asian population. That's a problem. Maybe not necessarily in other places, but we need that information here. We also need a large enough sample size. We need enough people answering the questions. Some of our surveys are relatively small. So we have large uncertainty about what's really going on. We need their information. We can't have smaller surveys. And the other key feature of this particular surveillance is that we need to combine information from multiple different sources to understand what's going on in Pierce County. We use a variety of different sources. Each one of them has different rules and regulations. They're all important. I cannot tell you that one is more important than the other. But what are the key messages from this entire surveillance project that we did? Well, it looks like we have improvements in breast cancer mortality, small but measurable. We see that the trends and the levels are different between the different racial and ethnic groups in Pierce County. This is important. We need to learn how to get different populations that are at higher risk in for their screening so that they can be better treated and reduce their mortality. What I haven't said, but was part of the report, is that our population is changing in Pierce County. Because the demographics are going to be changing, the demographics of the women who have breast cancer are also going to be changing. And how to screen appropriately those changing demographics is going to be a big issue in the future. And specifically in Pierce County, we believe that survival of Black and African American women is improving, but it's early and preliminary. I'd also like to introduce Leanne Noreen, who is the executive director of the Carol and Milgard Breast Center, and who actually commissioned this report. He's going to briefly mention how they use our information.
Chair Young and the Board of Health, thank you for having me here today. Thank you, Ingrid. Before I make just a couple of comments, I would like to congratulate and appreciate Ingrid and Matt for the great work that they did with us in commissioning this report. The process was really beautiful, and we appreciated that from our organization to the Health Department. I really made a big difference in how this all came about. As Ingrid said, my name is Leanne Noreen. I'm the Executive Director of the Carol Milgard Breast Center. And the importance of local data really is twofold for the Carol Milgard Breast Center. It helps us direct our program initiatives, and it strengthens our grant applications. We are a nonprofit clinic, even though we are jointly owned and managed by TRA, a third organization. We do apply for grants to assist our outreach efforts and the programs in the community that we conduct. Our board of directors also expects to have local data to be able to make those decisions. They are what I call a passion board. They are passionate about the outreach that we are doing in this community and answering the questions that Ingrid exactly brought up. How do we reach the women in this community who need to be screened? The 30% who are not getting screened, we feel it's our responsibility to get them in the door, and how do we do that? This is actually the third report that we have had commissioned, and the first one was done in 2011, and we are building on that report from 2011 to 2015 to now. The 2022 report was supposed to happen in 2020. We all know that didn't happen, but it's good to get caught up. And just to give you an idea, that 2011 report really kicked off some significant efforts at the breast center that still happen today. One of them is our community screening events. Those happen on a regular basis, not only from just general community recruitment, but also with organizations that are like-minded and that we partner with to reach different populations that are underserved. We also created Leaders in Women's Health, which is now a coalition and initiative of the Tacoma Urban League that was founded specifically to fight health disparities in the African American community. We work with that group very closely. And lastly, our Faith, Health, and Action program. This is a program where we partner with churches to create or support health ministries and do health education through their congregations. We started with 3 churches in 2016. As of today, we've had 30 churches participate, and we've expanded from the African American community to Pacific Islander and Hispanic communities as well. So thank you for letting me share a few comments. Happy to take any questions. Thank you for having us.
Thank you. Any questions from the board? Vice Chair.
Thank you, Chair Young. I don't have any questions. I just want to take a moment to express my gratitude. It's such an important topic. And for myself, looking at, I'm concerned at how many people didn't do their normal screenings and now fallen out of the habit because of the pandemic, and I'm afraid that we're going to see those numbers rise. And that really targeted important work in Black communities and Asian communities or Pacific Islander communities is just so vital. So I just wanted to take a minute to say thank you.
Thank you.
Yeah.
Board Member Beckett.
Thank you, Chair. Ingrid, thank you for that report. Thank you for yours. Just a suggestion, this might be an opportunity for our new media contract that we approved to get the word out to the people in these different areas that are so desperately in need of bringing those people in. Thank you.
Thank you.
Great idea. Board Member Hitchin.
Thank you, Chair. Thank you for the report. I am wondering, I'm new to the Board of Health. Is it possible to get the prior reports sent to me so that I can Okay.
I have access to a link for the 2015 one, and I can definitely make sure it gets to you for sure.
Okay, perfect. I would just like to dig into data. And then my second question is around, or comment, no, this one's a question, around the distribution of breast cancer. It was on slide 10, and it was referring to the unstaged versus the early staged, and I'm just, the numbers are startling as far as when you compare across the different demographics that are there, but really trying to dig into the unknown. So I think that group is a big enough group that really could be throwing off our data, and something could be way worse. And so I'm just wondering, as we go into maybe planning for the future, how we're going to make that sized group much smaller and with our data collection.
Right. You're right. One of the issues is relatively small populations for some of these, and we do need to investigate why. I've spoken with a woman who is from the Native Hawaiian and other Pacific Islander populations, and we've started brainstorming about some of the different reasons for why that particular population is so large. And so far, we don't have any particular ideas, although we are curious of whether or not it has to do with population migrations or other reasons, because this is someone who's come into the health system and then has chosen not to complete this process. So we are investigating it, and it could certainly deal with more data collection to better understand why those populations are much larger.
Because I know when we've been trying to really dive into demographic, data collection, people that don't fit one of these categories don't know what to choose, and so then they just choose whatever they're feeling. And so I think digging into how we're asking that information, so that for those especially that are multiple races together, can actually have a space that really reflects what they are. So we're collecting that data.
Well, I think it's absolutely fascinating. One of the pieces that I put in this report was really to specify that the racial and ethnic data are inconsistent between all of the different sources. So it's very important to consider these not as a gold standard, but as a way to indicate and understand, and as a question for further investigation.
Okay, thank you.
Thank you very much.
Thank you, Chair.
Thank you, and thank you for the presentation. That brings us to our final presentation. It's on Tacoma Creates and their participatory budgeting project, and we will introduce. I apologize.
Liesl,
thank you. The Community Engagement Coordinator.
Hi, Chair Young, Vice Chair Ashka, and members of the board. My name is Liesl Sankar. We met at the last Board of Health meeting, but let me reintroduce myself. My work as Community Engagement Coordinator under Health Equity under the Office of the Director. I'm extremely excited to announce the Tacoma Creates participatory budgeting project ended the voting, or the community has voted, and the community has selected the projects. Please note that the numbers in the slide you are now seeing, I've got to put that up first, sorry.
Now we're
Right, there's the results. The results are in, and this is the first day we're releasing them as well, with press release and blog, social media. Please note that the numbers in the slide you're seeing now and in your packet are not the most up-to-date, but I will give you the revised voting updated to you after this meeting. We finalized the numbers yesterday, and we didn't have the time to update the packet, but the changes are very minor, and they do not change the outcome. The really interesting and great news is that in 6 weeks, we collected over 5,000 votes in East Tacoma and South Tacoma. We could not have done this without community leadership, co-design, and boots on the ground. And I'm just checking to see, we might have a community member in the house. Nope, was not able to make it. But one of the extraordinary leaders was Lisa Mathus and Golden Bamboo, who were able to collect over 1,500 votes in the Vietnamese community alone, which is about 30% of the votes. In East Tacoma, Multicultural Festival Series netted 65% of the vote and will include 3 cultural celebrations: Lunar New Year, Juneteenth, and Dia de los Muertos. Each family-friendly festival will be 1 to 2 days long and offer a wide array of performances, storytelling, food, art, and activities. The project will be developed and implemented by the Tacoma Refugee Choir, working in partnership with local cultural groups. The remaining 35% of the votes on the east side were split between two other project proposals, Light Up the City and Tacoma East Side Free Wall. In South Tacoma, the South Tacoma Heritage Festivals netted 56% of the vote and will celebrate community diversity while promoting cross-cultural solidarity with a 2-day event featuring dance, music, cultural presentations, kids' activities, and more. And there will also be science and engineering-themed learning opportunities that focus on concepts and techniques, as well as career possibilities. The Asia Pacific Cultural Center will develop and implement this project in coordination and engagement with local grassroots organizations. The remaining 44% of the votes in South Tacoma were split between two other project proposals, Rock the Block and Cross-Cultural Community Mural. In summary, and I think these are the really important points, arts, culture, heritage, and science create spaces for cultural reflection, social connections, and collective healing. And participatory budgeting helps government serve the community better by leveraging community wisdom to help implement solutions to community problems. These are the types of strategies that will help us recover from COVID-19 and build a more resilient community. Thank you. And I would take any questions you might have at this point.
Just before questions, terrific participation for participatory budgeting. I mean, that's outstanding, and I particularly like, this is the rare time I'm going to praise ballot box stuffing. That's terrific. That one basically group was able to generate such enthusiasm. So, Campbell.
Thank you. Thank you so much. So great to see this. It warms my heart to see the outreach. If you know Lisa Methune, you understand why she was able to get that done, because she is just an amazing individual. Just seeing the strong turnout on the east side, it warms my heart. It doesn't surprise me, because there's been a lot of effort by the health department, by many other organizations, and just individuals within the east side that have been trying for a long time to increase engagement, and I see that here. And I love that we've got 3 festivals identified. It was, I believe, Lunar New Year, Juneteenth, and
Dia de los Muertos.
Thank you. You say
Day of the Dead.
you say that much more. Just reflecting back on the earlier one we had about refugees, we have a large Ukrainian, Russian, Moldovan population coming in, and I know that they're strongly represented and growing on the east side.
Yeah.
Is there a cultural celebration around kind of that Eastern European?
It's a great question.
That we missed.
Yeah, that's a great question. And I will take it to Erin with the Refugee Choir, who will be putting on those festivals on the east side. And I don't know how much you know Erin as well, but she works with largely with the refugee populations and is very on top of what's happening with the Ukraine refugees as well. So that's a great question, and I will be passing it along.
Yeah, seeing the 3 we have here, I mean, I think that's hitting it out of the park. And actually, they're well spaced throughout the year, but then just, kind of what's the next, and seeing this growing population, how do we engage them, make them feel welcome, and understand, because I learn a lot when I go to these festivals about the individuals and about their cultures. So thank you so much for your work on this.
Thank you.
Sure is good.
Thank you, Chair Young. I'm going to step back for a minute and talk a little bit about Tacoma Creates, because people listening might not have any idea what it is. So Tacoma Creates is an arts and heritage tax opportunity that the legislature passed, in 2019, I think.
18.
And Tacoma put on the ballot pretty quickly. I'm proud to say I got to co-sponsor it. And I really made sure that there was language in there to ensure that it got into the neighborhoods of the east side and the south end. Because I know that arts and culture are what builds community, what builds social equity or social capital, are those interactions. So I'm really excited to see these particular festivals, in part because they're existing festivals that either have or struggled or like the Lunar Festival is a tradition that people come from all over for, to be supported by these funds and not to be the community choice. It just reaffirms my faith in everything that's good and right and just. But I want to say that out loud in part because I believe the county could probably pass a tax like this if it wanted to too, and I don't expect an answer now. In Tacoma, I want to say it passed by like 67% or some ridiculous bit in every single precinct. And I know I'm bragging on Tacoma, but that's a pretty good thing to brag about. I have one question, and I do know the Tacoma Refugee Choir quite well, and I know Aaron quite well. These are all festivals that have been, except for Juneteenth, that have been operated or attempted to be operated by core groups of people in our community. And I was surprised, even though I should have seen this in the written materials that I saw before, that the Refugee Choir would put them together. Can you talk to me about that?
Sure. As much as I know, because I'm recent with the health department, so I came onto this a little bit late, but I do understand that these projects, as implemented or as once there's several processes with participatory budgeting. So once you get to the process of the ideas are distilled down, and you look for organizations that can fulfill the ideas that are solicited from community, that at that point those kinds of questions were arising, and what organization could help partner with all the organizations that are currently in existence, like Calavera Collective, Latinx Unidos of the South Sound, to do a Dia de los Muertos. And with the Lunar New Year, several Vietnamese and Cambodian institutions that are already celebrating. So I do know that part of the implementation contract will be to work with those partnerships as well that are currently existing and bringing them into the fold of these festivals. I don't know the details of that. I don't think they've been worked out between the city of Tacoma and the Refugee Choir, but we did have Victor Rodriguez basically put together a pre-contract that outlined the sorts of implementation questions you're talking about, that take the ideas of the community and put that into the contract, not what the Refugee Choir wants, but those ideas that came from community.
It's such a great opportunity to strengthen all those organizations, including TRC, which is, in fact, made up of members from all over this community as well. So that's very exciting. I have to acknowledge, too, that the high number of ballots that the Golden Bamboo team got. For those that aren't familiar, this is a walking group of Vietnamese women that live in Salishan, and they're elderly women, but you know, don't mess with them.
Yeah, they didn't ballot stuff. They walked blocks and blocks. I mean, I would get pick up the ballots, and it would say Pacific Avenue between South 56th and South 72nd. They actually went door to door to collect votes and talk to people, and I mean, it was an amazing job. And it just highlights that the community knows how to do it even better than anybody else, right? Yeah, they're an amazing group of people.
Is there a way, Chair, that the board could send a letter of thanks to them and any other organizations that participated in this, just because I think that follow-up on our end helps strengthen the whole process?
Thank you.
Great idea.
Great.
Thank you.
Thank you, Liesl.
Thanks. Thanks for your support on this.
Any other comments from the board? Board Member Beckett.
Back to Ingrid. Good suggestion to partner with Liesl. Get that word out.
Thank you. And seeing no other comments on the director's comments, that brings us to Section 7, comments by Board of Health members. Anything from the board?
I'll make one comment.
Vice Chair Oscar.
Thank you. As you know, I am the president-elect of the National Association of Local Boards of Health that has its conference in August. I want to make my board members aware of that. And even if you don't go this year, in 2023, the National Association of Local Boards of Health will be hosting their conference in Tacoma, which is pretty exciting. And since calendars are what they are, I am, in fact, trying to get it on your calendar about 18 months in advance. Thanks. First week of August. I'll get you the exact dates.
And if you can make the trip, I do recommend. I learned a lot going to my first year. So especially for new board members, one, you get to meet, peers from other parts of the country and kind of hear how they do things, but two, there was a lot of good, information that I gathered. So, but if not, next year. Any other comments? Board Member Campbell.
I do plan on attending, not this year, but next year. Congratulations on being chair of the National Boards of Health. Coming up,
Thank you.
but soon to be chair-elect. That's very cool. Just want to say how cool it is to be back here in person. I realized that in my time on county council, I actually hadn't been to a meeting in this room as a county council member. And so it has been, even though my name is still on the back of one of these, that's from many years ago. But thank you for coming together to get us back in person and being here, and I'm glad the sign still worked in the parking lot. So thank you all very much.
And I'll just lastly add, since we are in person, it's great to be back. Thank you all for all your hard work, and I know you continue to work hard, but since I get to see all your faces right now, I can tell you that, we're all grateful for everything that's happened over the last couple of years, and beyond that as well. It meant a tremendous amount of difference in our community. I think if you look at how Pierce County performed compared to a lot of others, unfortunately, I think it made a difference in a lot of people's lives. So, job well done. I believe there's no executive session. All right. Seeing no further business before the Board of Health, we are adjourned.
Great job.
Yeah, thank you.